Can I switch implants for fat grafting in buttock augmentation? Hello, I'm Dr. Rajat Gupta, board certified plastic surgeon working in Delhi, having experience of more than 2,000 body contouring procedures. I'm also the master trainer for body contouring procedures and train other plastic surgeons. And today, I want to talk to you about the most challenging procedures technically for plastic surgeons to perform, and that is buttock augmentation. Now, getting a bigger butt naturally is possible through diligent exercise, squatting, and other exercises. But at the same time, one has to understand not everybody can do it. Also, many of my patients tell me that in spite of doing all the squatting and all the butt exercises, they do not get the look they desire. And that's where they contact me and ask these questions. Can I use fat grafting to augment my butt? Can I remove fat from some other parts of my body and put it in my buttocks? And what will this procedure cost? So let's take these questions one by one. The first one being, can I use fat to augment my buttocks? Answer is yes, you can do that. Fat grafting is a fairly common practice done along with liposuction. So when you get liposuction, we remove a lot of subcutaneous fat from your specific part of the body, maybe abdomen, thighs, back, breast, chest, abdomen, wherever. We treat this fat and then reinsert it to where we want. So it may sound straightforward, but what you need to understand is this process is a complicated process because fat grafting to butts is technically demanding. So you see, beneath the skin, there are muscle layers. And when we remove the fat, between the skin and the muscle, this fat needs to be treated and put back in the buttock, again, beneath the skin but above the muscle. Because in the muscle, there are major blood vessels. And during the fat grafting, if this fat goes to these vessels, it can create havoc. There can be chances of fat embolisms, which may be in some cases life-threatening. So, fat grafting has to be done very, very precisely above the muscle, beneath the skin, absolutely in subcutaneous place, so that you get great result with absolute safety. So, your surgeon has to be an expert doing this procedure to help you achieve the shape you want in absolute safety. And for this, we doctors have devised a technique called as expansion vibration lipofilling, EVL. Now, this is a method in which we do fat grafting to the buttock absolutely safely. It produces the best possible result. Basic idea of EVL is that reverse liposuction. Fat is removed either through a traditional method or a microwave or laser. This fat, once put in a jar and purified, we connect the tube in a reverse manner as you would do in liposuction. So put that fat back through the same tools into the body. Now, when I use these tools of microwave and laser, these tools help me prevent trauma to the areas where we are doing liposuction. The recovery is faster, painless, everything, but we also get fat of good quality. This harvested fat is then purified. We wash this fat so that all the debris, all the blood is taken out from this fat and you get the pure form of fat back to where you want. These fat cells then survive in your body. These fat cells are made sure with the EVL technique that they are put in a precise subcutaneous layer so that the fat does not go deep in the muscle. Now, how does microwave work? Microwave uses a powerful vibration method to break the fat or break the planes beneath the skin. Usually, I use this tool to remove the fat from specific areas like abdomen, thighs, back, and I achieve an hourglass shape for my patients. Now, when I remove this fat, it keeps on vibrating and help me take out the fat easily, smoothly, so that the results are smooth and patient gets a smooth hourglass shape. Now, in a reverse engineering method of EVL, this cannula, which is a basket cannula connected to a microwave, keeps vibrating and making space beneath the skin and above the muscle. Now understand that this is making a space and releasing the fat at the same time because we are connected it to a container and it's flowing through a reverse manner. Now EVA technique helps us making sure that the fat is put exactly in the plane we want so that it's 100% safe and there are no chances of embolism. So, answer to your original question, can I get fat grafting for buttock augmentation? Yes, as long as you have a right surgeon operating you with sophisticated instruments in a well-equipped center and knows how to do EVL so that you get great results with absolute safety. Second question, what is the cost of buttock augmentation? Now, as I said previously, you need a good surgeon and a center of excellence to give a natural looking result, great result, hourglass shape with absolute safety. So the things which will impact the overall cost is your surgeon's expertise, the infrastructure of the hospital. This is not a clinic setup. This has to be done in a hospital. And the methods he or she will use for your fat grafting. Now, if someone is doing an age-old technique of a traditional liposuction or traditional syringe and needle or syringe and a cannula fat grafting, they may charge you less, but that comes with a huge risk. You need to have a surgeon who can do an EVL technique using microwave to give you a buttock augmentation. Obviously, this will increase a bit of a cost, but then you have to understand this is absolute safety with efficacy. So, if you have a good center doing all these procedures regularly, meet the surgeon, see some of their results, understand what their patients say about the procedures they have done with that surgeon, and then plan ahead. EVL is a great procedure, but it requires an expert hand. So your surgeon not only has to do EVL, but has to have experience with that surgery. So choosing a surgeon, choosing a center, choosing the technique is your homework. You have to do your homework to understand, and then the cost will depend on that. So also at the same time, make sure that your surgeon is a board certified surgeon. Make sure that your surgeon is trained with these tools, can show you some of his results so that you understand what your results can be. And at the same time, the center or the hospital has standard of care, has good tools. Make sure that all these things are there, and then you will get the answer for the cost. Understand that cosmetic surgery is an art, and art has no price. You have to understand that sometimes I get patients who try to save a lot of costs, get these surgeries done somewhere, may not be even sometimes from a plastic surgeon, and then that creates havoc. Cosmetic surgery is an art, but art needs safety. Anyways, I've tried to answer most of the questions asked to me by my patients for buttock augmentation. If you have more questions, please write into us and I'll be there to help you. Also, like, share and subscribe our channel. I'll be there to keep answering most of your queries for cosmetic surgeries, and keep safe, stay safe. Safety is priority in cosmetic surgery.